Hi, guys. Welcome back for our daily practice questions. As always, I first like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Now, I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 30-year-old male presents for routine screening. His hepatitis B serology results show the following: the HBsAg is positive, the anti HBs is negative, the anti HBc is a positive for your IgM. So, what does this result indicate? Is it A, acute hepatitis B infection, B, chronic hepatitis B infection, C, previous hepatitis B vaccination, or D, past resolved hepatitis B infection? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what's being asked of you, right? So here the stem of the question states, what does this result indicate? So we're looking at a hepatitis B serology panel. So we want to look at these results and see what they and interpret what they mean. I always tell y'all, just walk through. First, we want to identify the HBsAg, which is our surface antigen. And then we want to look at our anti-HBs, which are your antibodies, right? First, those are half the battle because it's going to let you know if they have the infection or if they have antibodies for some reason, right? So the HBsAg, the surface antigen, is going to identify if there's an infection or not, or if they've had it in the past. And the antibodies, right? The anti-HBs lets you know if they have antibodies for some reason. So here, the surface antigen is positive, so we know that they have the infection, and we want to determine if it's acute or chronic, right? So that's where we go and look at those core, the anti-HBc, C for core. And so the IgM is positive, remembering that IgM is for acute. So your best answer is A, this is an acute hepatitis B infection. Question number two, a 45-year-old female presents with elevated liver enzymes. Her hepatitis B serology shows the following results. Her HBsAg is negative. Her anti-HBs is positive. Her anti-HBc is positive for the IgG. What does this result suggest? Is it A, acute hepatitis B infection, B, chronic hepatitis B infection, C, vaccination against the hepatitis B, or D, a past resolved hepatitis B infection? Take a moment. Tell me what you think in the comments, you guys. All right, so stem of the question here states, what does this result suggest? All right, let's walk through. So the surface antigen is negative, so they do not have the infection, right? So that lets us know we can eliminate A and B. They don't have the infection. And then the anti-HBs is positive. So we know they have antibodies for some reason. Either they've been vaccinated or they've had hepatitis B in the past, right? So now we're looking at this core, and the core is positive for IgG, meaning past, chronic, right? So this lets you know that the best answer is D. This is a past resolved hepatitis B infection. So that's why they have the antibodies, right? So this is just like a standard panel of what it would look like to say if you had hepatitis and it's resolved, but your body's showing antibodies. If you've had COVID in the past and you have antibodies and it's showing, it's due to this. Because if you were never vaccinated, then it will present this way, okay? So this lets you know past resolved hepatitis B infection. All right. And last but not least, question number three, a 40-year-old male with chronic hepatitis B presents with elevated liver enzymes. His hepatitis B serology panel shows the following. The HBsAg is positive, the anti-HBs is negative, the anti-HBc is positive, of the IgG, what is the most likely diagnosis based on these results? Is it A, acute hepatitis B, B, chronic hepatitis B with high infectivity, C, vaccinated, or D, previous hepatitis B infection? Take a moment to what you think, y'all. So here we know it would be B, it's chronic hepatitis B because the surface antigen is positive, so we know they have the infection. And the core being positive for the IgG, remember G is chronic, so we know they have chronic hepatitis B. Now, y'all, typically I will add something else my intentions on this question was to add another layer just to throw this out for your learning purposes. And that's why I have with high infectivity on the end of that B, but I forgot to go back and add it. You can tell I really go into deep thought when I'm creating questions for y'all, and I go back and forth with, is this going to confuse them? Should I just throw it in here and there so they're learning extra tools so they'll also know this in practice? So I go back and forth, and I decided not to put it in the question, and then forgot to take it off of the end of that answer choice. But it's chronic hepatitis B because the surface antigen is positive and the core is positive for IgG. If the core was positive for IgM, it would have been acute hepatitis B, right? But don't let that high infectivity confuse you. It's chronic hep B. Okay. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But as always, y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. Or you can shoot us a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. And actually, if you go to my site or look at anything in the bio and you have questions, I actually recommend that you either call or text or email so that this can be clarified for you, because some of the stuff I have taken off of my website just to make sure that y'all are booking what is appropriate for what you need at the time. And so I have received some messages from you guys because y'all are wondering which direction to take on it. So always feel free to either call, text, or email. We are happy to assist you. All right, you guys. As always, you know what to do. Make sure you'll meet me back here. Happy studying. Bye, y'all.